The population of Uganda has grown significantly over the past century, maintaining a growth rate of about 3%. The age structure is now skewed towards the younger generations. The population, which currently stands at 44 million people, is forecasted to be more than 47 million in 2020 and 63 million in 2030. These statistics hold so much as regards the targeted growth of the country, which State Minister for Finance in charge of planning says are well catered for in Uganda's Vision 2040.
Our emphasis is ensuring that our policies and programs focus better on improvement of human capital through education, UPE, USE, tertiary education, vocational skills, and higher education, and improved health, especially immunization. In public health, our government has made it a priority of prevention rather than curative health services. As that way, we can eliminate 75 to 80% of Uganda's diseases burden.
The intended goal is to achieve a demographic dividend from the population.
To achieve the dividend, we need to accelerate a fertility decline and make strategic investments in health, education, and job creation. Besides, we must ensure inclusive growth that is distributed fairly across society and creates opportunities for all.
A large section of the population is still riddled by poverty, making it hard for them to access basic needs for a quality life. This includes clean water, environment, good feeding, and healthcare. Carl Hoffman, the Chief Executive Officer at Population Services International, says family planning is key if a country intends to reap from its population.
I think none of us can assume that these sorts of commodities are going to be free and always available. There's undoubtedly a need for people who have the means to do so to pay some share of the costs of contraception.
Population Services International provides support to Uganda's healthcare services through various organizations like ProFarm. Hoffman says that global targets for support are shifting, which may require countries receiving support find alternatives.
Traditional donors, that's probably going to decline. We should expect that. The role of the government will have to be greater. I think the government understands that. Also, you have new non-traditional funders coming into this space. Impact investors, high net worth individuals who want to be able to see the real impact of their donations. And also the power of the consumer. The power of consumers in every market, including Uganda, to make a bigger contribution to their own health. Those things are coming together. Will they all come together in a good way that allows us to meet health objectives faster than the youthful population is getting bigger? We'll see. It's a race.
He commended Uganda's progress towards fighting HIV and AIDS, malaria and other contagious diseases, but he says the focus should turn to sanitation.
If we don't maintain a focus on this, then we risk seeing an uptick in waterborne illnesses, diseases like cholera, which can arise from time to time, problems in nutrition, which prevents children from developing mentally and being able to function well in school. These are all connected to sanitation. Sometimes people don't pay enough attention to this, but particularly as you have a more urbanizing population, which is true in Uganda and many other places, the challenges of sanitation are only going to get bigger.
During the release of the State of Uganda's Population on Thursday this week, it was recommended that there is need to increase investment in young people through enabling health and education policies.
We will continue providing an enabling environment for creation of more jobs to lower the cost of doing business, that is, having affordable energy, affordable transport, zero tolerance towards corruption, etc. We have embarked on building industrial parks to attract investors who will create more jobs so that young, health-skilled Ugandans become the engine of our economic growth.
Walter Mwesije, NTV.
Thank you.